Earlier this year, the Crosse County Health Department received a $600,000 grant to expand well water testing for private well owners.
And what they're finding could have a significant impact on your health. News 8's Eric Jacobson tells us what health officials have been looking for in a News 8 Investigates report.
Martha and Mike, arsenic in private wells is becoming a growing concern for officials at the Crosse County Health Department. Surprisingly, it's an element that is naturally occurring in nature. It has no taste or smell, making it impossible to determine if it's in water without a test. Arsenic was first discovered in Wisconsin groundwater in 1989. Now, as you can see on this map, the Fox Valley region in the state has been hit particularly hard by arsenic contamination. But as we take a closer look, La Crosse County has seen the contaminant as well. Now, health standards say anything above 10 parts per billion could be hazardous to your health. Now, parts of La Crosse County is measuring arsenic levels 30 times above that standard. But as health officials will explain, there is not enough conclusive data to determine the extent of the problem. And low-level exposure to the contaminant over a longer period of time can have a significant impact on someone's health.
A lot of things we see manifest in the skin first. We'll see, funny little bumps and funny little sores and thickening of the skin on the hands and feet. Probably some of the biggest concerns that we have with exposure to arsenic over long term are more cancer related. Specifically skin cancer, bladder cancer, and lung cancer are probably the most common cancers we see associated with more chronic exposure to arsenic.
Now, because of concerns over property values, owners of those wells who have tested positive for arsenic declined to speak on camera. However, I spoke with the La Crosse Realty Association and was told the owners of those homes would have to disclose their findings to potential buyers, so future homeowners would be safe from arsenic if the contaminant is found and treated. But health officials are concerned about the well owners who haven't tested their water for arsenic and who may not know that they have this potentially dangerous element in their water.
I thought that was really great.
In a small room in the town of Farmington in rural La Crosse County, Bradley Walker is quietly listening to a presentation from the health department.
We saw the meeting in the paper today for tonight and decided to come.
What he's hearing is an alarming discovery of contaminants found in water in private wells, including arsenic.
I think a lot of these wells are probably quite old. They've had no maintenance done on them. And they've never been tested or haven't been tested in 20 or 30 years.
He's had his water tested for nitrates and bacteria before, but never for arsenic. He says this meeting is convincing him to have his water tested again.
I want to do a pH, metal panel, and I'll test for bacteria again.
Residents like Walker are who the La Crosse County Health Department is trying to convince to test their private wells through their new federal grant.
Right now, there's no regulation that dictates to people that they have to test their water. It's really up to the well owner to decide what kind of monitoring they want to do.
The La Crosse County Health Department estimates only around 600 out of 8,000 private wells have been tested for arsenic in the county.
And about 2.5% of those samples have exceeded what's considered the safe level of arsenic in water.
While that may not sound like much, officials say the level of arsenic found in those wells is staggering.
We've seen readings as high as 300, so 30 times what's considered an acceptable amount. When I hear 300 or 350, that's a major problem that will affect a person's health.
County health officials say those levels appeared in the southern part of La Crosse County, in the townships of Shelby, Greenfield, and Washington.
Once we started seeing wells show up with these metals, it really made us ponder, what's out there that we don't know about.
The health department in La Crosse has been able to test for nitrates and bacteria for several years, but well owners had to send their test samples to labs outside of La Crosse for arsenic and other contaminants. But through their grant, the department,
this is an atomic absorption spectrometer,
is making it possible to test right here in La Crosse.
We'll be able to measure concentrations down to parts per billion, which is extremely small.
The county is also hoping to use the federal grant to create a map showing the extent of the arsenic problem. To create the data for the map, the health department is using meetings like this one in the town of Farmington to convey their message.
Without the grant, we would probably be still back where we were.
Doctors at Gunderson say it is essential for all private well owners to test their water.
Anybody that's buying a new home or having a new baby or has young children, I recommend get your water tested.
She's glad the county is educating the public on the importance of testing for arsenic.
It's nice to know that the county may be expanding some of their testing because I want my family to be safe. And then, you know, if I have beef cattle and I want to sell my beef cattle, I want my beef cattle to be okay for people that would consume them.
She stresses that once a problem is discovered, it can most likely be solved with a filtration system.
We have several filter systems at the point of entry where the well water comes into the house that filter there, and then we have secondary filtration system which is at our sink where we have a reverse osmosis filter there that filters out things like nitrates and arsenic.
For Walker, the public information meeting has once again convinced him to test his water.
Peace of mind more than anything else. I just want to be sure that there's nothing there.
And health officials hope others will soon do the same.
We really don't know what's in the water until it is tested.
Now, because of the grant, the health department can now test for arsenic, lead, iron, as well as many other elements. The cost to test arsenic is $29, testing nitrate is $25, and a full metal scan will cost you $65.
Well, Eric, you've been talking about specifically private wells and any elements or contaminants that are found in those, but what about the public wells that service things like our area restaurants and businesses?
Well, cities are required to keep the standards below that federal standard of 10 parts per billion. Now, according to the latest water test by the city has levels of arsenic at 4 parts per billion, which is less than the federal standard, but in 2010 that standard was 0.6. So the trend is showing that there is a rise in arsenic levels in the water.
Okay, thanks very much, Eric. Very interesting.